Good afternoon, folks, and welcome to the sunny streets of Jonesboro, Tennessee. We're standing here on Main Street, and I've come to the point where we just have to make this announcement. And after many hours of reflection and consultation with our local health officials, I've decided to go ahead and sign this order requiring face coverings where social distancing is not possible. Between July 6 and today, the number of patients admitted to our local hospitals has climbed to 45, doubling each week for the last 2 weeks. Currently, we have 12 COVID-19 patients in our ICUs in our local hospitals, and 5 of them are on ventilators. Numbers like those, along with the fact that we need to flatten the curve without reverting back to our previous phase of closure, has led me to this point. We don't want to pedal back with closures. On July 6th, the American Hospital Association, American Medical Association, and the American Nurses Association issued an open letter to the American public advising that we must resist confusing reopenings with remaining to normalcy, because that result would lead to more suffering and death, and urging 3 simple steps to wearing a face mask, maintaining social distancing, and washing our hands. On July 7th, we issued an order addressing face masks in the Washington County public buildings and facilities, and encouraging at that time public business establishments to follow the order and the Tennessee Pledge. On July 9th, just last Friday, the Supreme Court issued an order regarding face coverings to be required by all persons who are entering our courthouse. So this order has essentially two components to it. Face coverings in public, except for the exemptions recognized by the CDC in accordance with the CDC guidelines, all persons 12 years and younger, and including employees or customers of businesses, are required to wear face coverings or other similar coverings in public settings where being in close proximity to each other is anticipated, and particularly where other social distancing measures are difficult or impossible to maintain at all times. These face coverings may include homemade masks, scarves, bandanas, or a handkerchief to allow them to be created from home and household items and made of very low-cost materials. All commercial business establishments that sell goods or services, or a combination thereof, including but not limited to grocery stores, restaurants, public spaces and hotels and other places of lodging, pharmacies, banks, bars, saloons, retail stores, medical and dental offices, and entertainment spots and venues are required to follow the order and encouraged to follow the guidelines of the Tennessee Pledge, which has been issued before. I have with me today several members from our health community. Rebecca English, Director of the Regional Health Department. I'd like to invite you up just to say a word or two. Thank you.
Thank you, Mayor Grandy, and we are here today just to give information about it is important for everyone to wear their mask, to continue to social distance, and also to wash your hands. With all those 3 items combined, that can help reduce our cases of COVID-19 in our region. I appreciate Mayor Grandy for inviting us here. I appreciate everyone that if they could take those measures and do their part, we could reduce the cases of COVID-19 in our area. I will now turn it over to Dr. Kursky, our Regional Medical Officer for the Northeast Region for the Tennessee Department of Health.
Thank you. Yeah, so as we know from watching the Tennessee Department of Health website and other websites, that cases are increasing all the time, and they're actually increasing at a faster rate than ever. So we definitely support any measures by county officials, by any of our local officials to help reduce the incidence of coronavirus. Locally, our cases are higher than ever, and again, they are increasing at a faster rate. Hospitalizations are increasing. So again, to protect those people that are most vulnerable in our communities, we recommend wearing a cloth face mask whenever social distancing can't be maintained, especially indoors, outdoors when social distancing can't be maintained. Really to protect, again, those most vulnerable people in our community, people that are older, have pre-existing conditions, because again, we are seeing increased hospitalizations. We've had a recent death in our region, so we definitely want to do everything we can so that we can stay open. So as the mayor said, and Rebecca, our regional director, said, you know, anything we can do, wearing cloth face masks has been shown in multiple studies to decrease transmission by up to 80%. So we definitely encourage people to wear cloth face masks, maintain social distancing, avoid crowded spaces, stay home, especially if you're sick, hand washing, and all the measures we've been talking about. So because our cases are increasing, we need to do a better job if we want to keep our economy open. Thank you.
Rebecca and David, just want to say thank you for joining us here today. It's today we joined together with our colleagues in Sullivan County, the two largest counties in the region, and the most affected by the upcoming event on Wednesday at BMS, and we are looking forward to a successful event, and we're looking forward to a healthy event. So it's important for our local businesses to do their part. They're a great part of our community. It's painful to see them closed for a month and a half, and while we don't anticipate going back to that level, it's now the time to step up and do what we can to encourage all of our citizens to wear a face mask. So that will conclude this announcement today, and just thank you for being here. If there are any questions, we'll take them now.
Can you talk a bit more about the precise locations where masks are going to be required?
So we're asking businesses, as you heard, to essentially, you know, follow that Tennessee pledge, which is working with their employees, being sure that they're healthy. If they're not healthy, sending them home, temperature screening, hand washing, social distancing, and face masks.
And are there going to be penalties associated with not wearing a mask anywhere?
Well, the governor's order allows for enforcement. It's one of the things that I will not be doing is asking our law enforcement to be burdened with chasing around folks who don't have a face mask. We expect that our local citizens will do what they've done really for the last 4 or 5 months and step up and be proactive and embrace this challenge to help stop this increase in the coronavirus.
Do you think it'll be effective without enforcement?
I do think it'll be effective. If I didn't, we wouldn't do it, and that's why I've resisted to this point in moving forward with it. But I believe that people will take seriously this requirement that's been put on the folks in Sullivan and Washington County, and that they will step forward and that they will do the things that they need to do to keep us a healthy community.
Mayor Green, this time frame is a little bit shorter than the one in Sullivan County. Is there a reason this one is only until August 3rd?
That's when the governor's order that provides me the authority to do this ends.
And do you think school opening is going to be affected by this?
I don't anticipate school opening will be affected by this. What will affect school opening and the ability to keep our kids in school and in the classroom is having a healthy community. And that's what we're facing right now and trying to encourage people to promote.
And are you going to require businesses to provide masks to their
restaurants, hotels, just about any form of business. They're not required to provide masks to their customers, but they would have the ability, if they chose to not allow a person in their business if they didn't want them to be in there without a mask.
Last week, we asked you about a potential mask mandate. So talk about that thought process. What changed from literally 1 week ago to now?
Well, that's a great question, and it's simply, we look at a lot of metrics. I look at the numbers every single morning and probably several times during the day. And so what got my attention was not just the number of cases growing in our region, and specifically Washington County, but the admissions to hospitals. And so, as you know, the hospitals have a limited capacity for, one, for COVID patients, and two, just in general, limited capacity. So what we don't want to do is have to go and get those plans that we made back at the beginning of this thing in March and pull them off the shelf and have to implement them.
And do you mind recapping enforcement for us again, so law enforcement won't be involved?
Well, law enforcement is not going to be tasked with the responsibility of being the mask Nazis and out there, requiring people to wear masks. We think that that people will accept the challenge, they will accept the responsibility. I look around the streets here in Jonesboro, and there's a lot of people in masks. Once people understand the critical nature of where we are in this region and where we were, which goes back to the beginning of your question, 2 weeks ago we didn't have a lot of cases and we didn't have a lot of admissions. But for 2 weeks in a row, cases in the hospital in our region, Sullivan County and Washington County, Virginia, have doubled each week. At that rate, we don't have the capacity to go any further.
Any thoughts at all on how this might affect big locations, like UCSC, for example, announcing today 3 of their players testing positive? Any effect at all?
Sorry. It's one of the perks you get with Jonesboro. Not every place, can offer you such a dramatic backdrop. All right, try me again on that.
Okay. Any effect at all this mandate will have on big venues, locations in Washington County, say UCSC, for example, where 3 of their football players tested positive?
Well, not specifically. The university does a great job, and they have from the beginning, with respect to managing the COVID-19 virus. They are more than capable. They've got all the medical talent that they need to make really, really good decisions for their program, and I know that they're going to do the right thing.
Is there any leeway for cities to come up with their own specialized rules within this?
Not under the governor's order. It was relegated to the county mayor, and obviously in the rural part of Washington County, we're not going to anticipate, that a lot of our folks are going to be, when they're on the farm or working in the garden or mowing grass, if they don't want to wear a mask. Social distancing is the key. If we can create enough separation, mask or no mask, we'll be in good shape. Now, in some of our venues in Jonesboro and a lot of our venues in Johnson City, we have very confined spaces. And in order for these restaurants to operate, they're back at 100% capacity now. But the request is that they create social distancing. So as long as they can do that, and they can have their patrons coming in with masks and so forth, I think we'll keep really, really healthy facilities. The restaurants that are doing a great job and working hard and trying to comply, they know who they are, and probably most of us know who they are. And there's a handful of outliers that are obviously not taking this seriously. They have infected people in their facility, and they're just, not interested in complying. Well, I think over time, individuals will understand which are the safe places to go, which are the maybe less safe places to go, and we'll support those businesses. As you know, when we came out, my task force put together a program ahead of the state of Tennessee that identified businesses, restaurants, retail, whatever, as complying with the Tennessee Pledge. and we provided stickers, and we provided yard signs to those businesses, and they're still up. There's a website on regionahead.com where any one of us can go and see what businesses have logged onto there and agreed to be compliant with the Tennessee Pledge. And so that's an easy way for individuals to go to a safe place.
Do you believe that all businesses need to be wearing masks even if they aren't serving the public?
Well, it depends on whether if they're in close proximity. I mean, again, social distancing is a key, and masks when that's not possible, or some other shielding device is not possible. So what we're asking for is compliance to reasonable, and that means, you know, being safe. And so what the health department people have said to us is when we speak that, you know, our spittles can go as far as 6 feet. So if you're 6 feet or further away, you're out of range. You know, theoretically, you're relatively safe in terms of social distancing. So when people come in and sit and eat, obviously they're not going to eat masked up. They're going to sit at tables, and they're going to either be 6 feet apart from folks that were not part of their group, or if it's a group or a family, then they can sit together.
I have a question for Dr. Kirsty.
Great.
Thank you.
Perfect.
Okay. All right. Dr. Kirsty, a lot of backlash, a lot of people saying that masks and mask wearing should be a personal choice. When you have a mandate like this, what is your advice for people who say, you know, contrary, that masks should be left up to the individual?
Yeah, so in terms of mask as a personal choice, I think a lot of people have the misinformation that the mask's there to protect themselves. I think if as more people understand that the mask is to protect other people, I think it's a little bit different of a sentiment there. So I think if people understand, I think the most important thing for mask compliance, rather than having law enforcement enforce it, is one, people understand why they're wearing a mask, and that's to protect other people around them, especially people that are at high risk. The second thing I think that's important for mask use is just leaders in our community modeling good mask wearing behavior. So I think those two things are probably the most important to increase the amount of people wearing masks. We do encourage businesses to try to incentivize masks, you know, rather than have a stick, use a carrot. So any way that we could incentivize people to wear masks in different businesses or in schools. So, you know, if we want to have things to be reopened, if we want to have sports going on, you know, in the fall, I think people need to step up and wear masks and do other social distancing and preventive measures for coronavirus.
In your health expertise, do you think a mask mandate like this will help stop that rise in coronavirus?
Yeah, so masks have been shown in numerous studies to reduce transmission by up to 80%. We're seeing lots of transmission in our community in all kinds of settings, whether it's schools, businesses, large events, sports. So really optimizing mask usage is one of the most important tools we have to try to limit the spread of coronavirus.
This is one of the first mask mandates here in Northeast Tennessee, the second one, but the first one in your health department area coverage. Do you anticipate more mayors doing this in the next couple of days, and are you encouraging them to do so?
Yeah, we certainly support any efforts to decrease the transmission of coronavirus. From a health department perspective, we're seeing more and more cases every day, and they're increasing at a greater rate than ever. So I think it's definitely time that we do everything we can to try to reduce that spread. So masks being a very important piece of that.
We've had a couple of people reach out to us talking about testing, saying that they're having to wait a long time, that there is a long turnaround. Do you have any update on where we're at with testing right now in Northeast Tennessee?
What was the final part of the question?
Do you have any update on where we're at? Like, what's the turnaround time? What can people expect when they go get tested now?
Yeah, so unfortunately with the huge increase in cases around the country and within the state, the turnaround time has increased. So the time it takes after someone gets tested to their test result is about 4 days right now. Previously it was 1 to 2 days. So labs are trying to ramp up so that they can reduce that turnaround time. That turnaround time is obviously problematic for both the patients and public health, trying to control, you know, make sure that person's in isolation and control further spread. So we certainly support efforts by, you know, government and by the labs to decrease the turnaround time.
Do you feel like people will voluntarily wear masks on their own, or do you see any kind of enforcement mechanism like a fine, like we've seen in Knoxville?
Yeah, so we do think people will, if our leaders in our community do model good mask wearing behavior, I think other people will follow. Obviously not everyone, but I think we can get a critical mass of people, just one, by increasing education about the importance of masks and why we're wearing masks, which is to protect other people, especially people that are vulnerable in our community, and also by modeling that behavior. I think we can get enough people wearing masks where it'll make an impact. You good? Thank you.
Okay, any final questions before we give it up this afternoon?
I have one question for you. Obviously, we know that Johnson City, a lot of people come to Johnson City and Washington County from surrounding counties. What do you have to say to the people coming into your county that might not want to comply?
They might not want to be what?
They might not want to comply.
Well, I say stay home. I mean, we want to bring people into the community. Part of our livelihood and having our business be successful is folks coming in to visit us and dine with us and stay with us and buy from us here. And that's why we're here. And so we want folks to come. We want them to come compliant. We want them to come safely. We know we're going to have some folks in from the surrounding areas and beyond on Wednesday night for the Bristol Motor Speedway race. And what I would like to see is that our community set a positive example with respect to the CDC guidelines, face coverings, hand washing, social distancing, and don't be afraid to say to somebody that's not from here, hey, we're a healthy community. That's why we're able to have this event, and we expect you to comply while you're with us. All right, so I guess I would say that 6 months ago I would never have been able to say that our health department folks are my best friends, but we have gotten a lot of time together over the last few months, and I just want to say what a great job that they do in Washington County. They're regional, but in Washington County, our health department is averaging almost 300 tests a day for folks, and some of you were out there last week when the governor stopped by. The reason he came here last week was because we have one of the best testing facilities in the state. So thank you all very much for what you do. We appreciate all your good work. Thank you for sharing some time with us this afternoon and allow us to make this announcement. Have a good afternoon and be safe.